Welcome, welcome, welcome to Health Issues 2010. I'm your host, Chris Sylvain, and believe me, we have a great show for you today. It is a very important issue that's happening. It's affecting the city of New Orleans, will affect the city of New Orleans, and it's a part of this major healthcare issue, but it's about something that you all are familiar with, and that is charity hospital. Unless you've been under a rug somewhere, you know about the issues that are facing this decision that our city has to make very, very soon. But we have two people here, believe me, they are well versed in the subject, have a great interest in it, and we have Ms. Sandra Stokes. She is the Executive Vice Chair of the Foundation for Historical Louisiana. Welcome, Ms. Stokes.
Well, thank you.
And we have Dr. James Moises, emergency physician of former Charity Hospital ER physician. How you doing, doctor?
Good to see you, Chris.
Did I get that last name right?
That's it.
Excellent. I did. Oh, it's all right. It's all right. Well, welcome. We appreciate having you guys. Let's first talk about this issue of Charity Hospital and this argument about where to place it. If you can just get started. What is the argument? Why are we talking about this?
Well, at first, I think they closed Charity Hospital and said it wasn't usable, but our organization was charged by the legislature to do an independent feasibility study of reusing Charity Hospital.
Okay.
And once we determined that the building was structurally sound, we couldn't figure out why they weren't interested in using it, because you've got a historic medical district right downtown with a lot of square footage of buildings. Mm-hmm. So the architects, we hired the 7th largest architectural firm in the world.
Wow.
And they took the LSU programming that they were going to build for their new hospital and inserted it into Charity Hospital. Okay. And they found that if you gut the building and you could rebuild it with a brand new state-of-the-art facility equal to what you're going to build new, and you can do it faster, and you can do it by saving over $283 million.
Well, it sounds so simple. Why is there an argument then?
That's a good question. For us, it just makes common sense. It's economic sense. It's a faster way to get health care back. I think that's one of the most important needs in New Orleans right now. It is a faster way to get the jobs back. It's a faster way to kickstart the bioscience district. And I think it only makes sense.
Well, we have a few charts now. If you can go ahead and they'll put those right up, and we'll be able to look at these sites to have an idea of what's going on here. One of the charts, there it is, it's right on the screen now.
Well, the area in red is the Charity Hospital existing right now and the VA hospital, and that area will be vacated, and what they want to do is take the area to the left that says VA Medical Center and the LSU Medical Center. That's 70 acres of residential and business, 163 of which are historic buildings, and they want to take out that area of residential, the residential area, and move the medical center down there, and pretty much abandon downtown with no real plans or money for redevelopment.
Look much like some of New Orleans post-Katrina, the lower Ninth Ward and areas
that's right. And what they say is that we want to be like Birmingham, and we want to be like other wonderful medical centers, which we can be. But if you look at other wonderful medical centers, there are mixed use of old and new buildings in urban settings. What they're looking to do here is a suburban setting.
Okay. Now, you guys are from the Foundation for Historical Louisiana, so the interest in and of itself, you're really looking at the buildings and the use of buildings and so forth. That's a major interest?
Well, we got into it because the legislature asked us to do an independent study, but once we got into it, we looked at preserving the neighborhood. That's a big issue, and when housing is so necessary in New Orleans. We also were looking at preserving Charity Hospital, but it got way beyond that very quickly. This is about returning health care. This is about economic development, and it's about transparent government. All of these plans have proceeded behind closed doors. And so we're asking for public meetings and public discussion, and the city council to take a stand and hold public meetings and have a little more transparency. It's about economic development, it's about health care, and it's about the bioscience district that can be the recovery for New Orleans.
Interesting, interesting. And there are a lot of people that would be displaced, obviously, that
yes.
From what I understand, that all are not very happy about the displacement.
That's true. That's true.
Interesting. You have another slide that they can bring up.
That's not it.
I think we have a couple more
Okay.
here.
What we're proposing is to slide the VA closer to the interstate that's running north-south on your screen, and have a more synergistic medical district. And that way the VA Medical Center, which is in yellow on your diagram, would be co-located with LSU and Tulane and the LSU School, Delgado School of Nursing, the new Bioinnovation Center, the new Cancer Consortium. And there's plenty of area in there that you could start to build new bioscience corridor. New buildings can go in, new research.
Well, let me ask you this. My understanding, but the VA Medical Center, can that actually be changed? Is it already a done deal? From my understanding, 2012 is when they expect to have completion?
Well, they have their money and they're ready to move forward, and we're trying to appeal to them to use a more cohesive plan with this. And you want to talk about that a little bit?
Sure. The VA right now their current plan is assuming that the LSU plan will move forward as is, and by us explaining that there are better options and alternative plans which are better for the entire community. You know, my role in this entire battle, as we'll call it, is more from a people perspective, a patient care perspective, and one of medical education. And also one that I think is what's best for the community. And clearly from looking at these diagrams, you can see by keeping the entire medical community cohesive, by bringing it and keeping Tulane as a part of this entire biomedical science complex, both medical schools benefit from that. So the VA, I think, is willing to, they've decided they want to be in the downtown area, which is good for everybody.
Okay.
Now it's just a matter of whether they're going to be in the heart of a residential area or closer to the downtown urban footprint.
Okay. Now, understanding that this new facility that they're proposing, $1.2 billion, it's supposed to be a huge thing. The argument is that it's supposed to have enough beds to take care of the indigent as well as non-indigent. For people, it can handle poor people as well as those that have third-party insurers. It had the synergy, but now that's gone between the VA and LSU that allowed doctors to be able to mix and come together. But we see all of that falling apart right now.
Yeah, about 3 years ago when they first decided to move forward with both of these new hospitals, it seemed to make sense. Let's share facilities. That really hasn't happened in the nation anywhere, really, where a VA hospital and another private or state institution have shared ventures. It just hasn't worked from the research that I've done. So what we have now, as reported last week, is there really is no synergy between these two facilities other than the doctors will work at both hospitals, which is what we've had pre-Katrina as well.
Okay.
But if you've chosen your locations, what we've been told all along is that they had to have these locations so that they could have this co-location and they could have all this shared services, that we could save all this money. But if there are no shared services, then the premise for the selection is wrong, and maybe we don't have to take down a historic neighborhood, and maybe there are other alternatives. It's, you know, we need to really look at all of the reasons why this is moving forward.
So, with more reasons, with more things going on, nobody really knows then.
We think we know. I mean, the plan that's being proposed now by the Foundation for Historical Louisiana with the support of the RMJM Hilliard architectural firm, which is one of the largest in the world.
Right.
They've been contracted to build the LSU Cancer Center. So this is not a amateur type firm that is just supporting our cause. These are experts who have looked at everything and said, you know, if we go back into Charity Hospital, we can make it a state-of-the-art hospital. We can make 400 plus beds, just like the LSU proposed hospital, and give state-of-the-art care. But the advantage of going into Charity Hospital is that we have hundreds of millions of dollars left over to support those other areas of medical or healthcare infrastructure that we won't have if we use the current LSU plan.
It's kind of like when you choose to go to MD Anderson, do you choose it based on the building, or do you choose it based on that they're the best? So if you've got this money that you can put into attracting the best faculty, getting the best equipment, having the best technology, wouldn't it be better to create the world-class medical center in that way. The building doesn't matter. If you can get the same services out of either building, why not just go ahead and do it, save a couple of $100 million?
Well, let's look at this from the standpoint of Mrs. Jones that's sitting there, and they may have a grandmother or somebody that has been going to the old Charity, and there are many people that are saying that old Charity was disgusting. It was dirty. It took too long to have care. Maybe it was top rated, in many areas, but the overall feeling was that it needed to be torn down, and we need to start and do something different. And so I think that feeling gets across in the community.
Well, and I worked at Charity Hospital for over 10 years. I trained there, and I worked there as an attending physician in the emergency department. It was an amazing place.
Okay.
The cosmetic part of the building was something to be desired because it lacked influx of money over the years from the state and the LSU system for cosmetic reasons. But what most people don't know is 3 floors in that building were renovated within the last 10 years to 2005 standards.
Okay.
They look as nice as Ochsner, East Jefferson, any private hospital. The issue with Charity Hospital is if we build a new hospital, we're not going to change the way the access worked, because that has to do a lot with more complicated things, such as the fact that we have so many uninsured patients in this state and in this city, and they're all channeled into one particular system, which is the Charity Hospital system, which I'm a big supporter of. It absolutely works. It's a true safety net system. And so whether we do it with the new hospital and spend a whole lot more money and take 10 more years to do it, or we do it in the current structure, which is the Charity Hospital that we have now, and save hundreds of millions of dollars and get it online in 3 years, that's a big difference. Because right now, access is a big issue. I'm a practicing emergency physician right now. And if someone calls me who doesn't have insurance and they're sick, other than emergency care, it's a big obstacle for them to get care in this city. University Hospital is not Charity Hospital. The LSU Interim Hospital is about 140 inpatient beds. It's small. So we can get health care back on track, which is a big part of our recovery in this city, in a very short amount of time. There are so many unknowns. But one thing that we do know for sure is it's going to take 10 years if we go the LSU route right now.
Well, let me ask you this. That other money that will be saved, obviously we need money infused into the healthcare system because the amount of uninsured patients, I'm sure, are projected to grow in the current economic environment and not decreasing. Is there any plans for that money to be used to take care of these patients in this new building, the new Charity in the same location, or is that a part of the mix? Does anybody know of anything?
A part of the $1.2 billion, you mean?
Yeah, I would say if the FHL proposal, if it's rebuilt right there on, I guess, Tulane Avenue, the money that's saved between the $1.2 billion and the $400 million it would cost to redo that hospital, that money that's saved, could that be used to extend health care, preventative care, better management of the hospital, those things to where it'll help Ms. Jones?
Absolutely. I mean, if we're going to appropriate $1.2 billion for some health care project in the city, the more we save, the more we have left over for actual patient care. I mean, we're talking a lot of money now for bricks and mortar. We're not talking about bringing in state-of-the-art equipment, the doctors and the staffing that needs to go along to take care of all of these very sick people. And so if you build a Goliath, but you don't have the right resources on the inside, and you don't have the experts, that's what makes healthcare. That's what makes state-of-the-art healthcare. It's not how pretty the building is, or what the windows look like, or how new it is. It's who's on the inside.
That's right.
You know, we use MD Anderson as an example a lot. I'm sure right now, if anybody got referred to MD Anderson for their cancer treatment, nobody would say, wait, send me a picture of the hospital before I go. They'll say, thank God I was able to get in so that they could take care of me.
So it's back to investing in your people, in the infrastructure, into the healthcare itself, rather than into a building.
Making sure that the doctors have all of the information and equipment that they need, making sure the nurses and the staff, when I go to a physician, you spend very little time with the physician. You're looking at you're spending time with the clerk and the nurses, and you want to make sure that they're taken care of so they can give you Ritz-Carlton type service as opposed to the I hate to use the name of an industry, but something that's horrible. that's what you guys are proposing for.
Yeah, the current LSU plan will just strangle the healthcare budget in this state for many, many years to come. And the proposal that's being put forth by the Foundation for Historical Louisiana is going to say, you know what, we can do the same thing for a lot cheaper with no debt load. You know, most people who aren't involved in banking and numbers don't really understand what $1 billion debt load on a project is. That may never, ever get paid back by this state. It will strangle healthcare dollars in this state for an extended period of time. So what does that mean? It means we maybe have less chemotherapy to give to cancer patients. It means maybe we can't do CAT scans and MRIs on a regular basis. It means, you know what, instead of those 450 beds being open, maybe we can only open up 250 beds. So that's what it means when we overspend and when we get into a project that may strangle the healthcare dollars of this state for decades.
And we're in a financial crisis. I mean, why would you choose the most expensive option on the table when there are other means that not only revitalize the downtown area, it also saves the neighborhood when we need the housing, and it's just so much, it just makes common sense.
Now, what about the argument? Let's bring the argument about moving to this new facility, and even if there's no synergy, would create such a world-class institution. Doctors would travel from all over the world to practice there.
You're back to, do you go to MD Anderson for the building? If you can have the same state-of-the-art facility inside of Charity, and you could use that 1.5 million square feet of vacant buildings around Charity to expand for ambulatory care and clinics and all the services that you need, why not?
As someone who used to recruit doctors to come to work at Charity Hospital, I'm talking about the old Charity Hospital. They didn't come to Charity Hospital because it was pretty. They came to Charity Hospital because even though the physical plant was was something to be desired, the quality of care was good and the access was amazing. We took care of people who were sick, no questions asked. And people who will go into medicine and go into healthcare go into it for the humanistic value. And so we don't need a brand new hospital to recruit the best and the brightest. We need resources and support from the medical schools in the state to allow us to give the best care possible.
Well, let me ask you this. If your plan goes forth, and we're going to go over that slide next, but if your plan goes forth, is there enough support now to be able to make that happen at on Tulane Avenue? Is the planning structure, is everything in place to really make it happen, to have this facility right where it needs to be? It seems as though the LSU has this huge plan for moving the hospital and so forth, but is the plan available? I mean,
well, what we're looking at with the LSU plan, last month we testified before the House Appropriations Committee. There is no funding available at this point. They have $300 million in capital outlay and whatever money they get from FEMA, but it's still far from what they need. They need to fund it by bonds, and we don't see that that's going to happen in this present market. So this project, actually, they may have enough money to finish their designs, and they may have enough money to acquire the land and take people's homes, but after that, what happens? It could be years and years before the healthcare system gets back up. We think that New Orleans needs healthcare now. We have a faster solution, we have a cheaper solution, and don't understand why we won't go ahead with that.
But what you have to understand too, it's not an inferior solution. It's as good, if not better, than the LSU plan. But the best part about it is the money's in the bank. There's $300 million from the state in capital outlay, and there's $150 million already offered by FEMA. Our current plan is $450 million to bring Charity online in 3 years and make it a state-of-the-art hospital. The money's in the bank to do our plan.
not even counting if Janet Politano comes up with the other
That's all
agreement.
ifs. And even if they come up with that, they still have to come up with hundreds of millions. The money is in the bank right now, essentially, to start the renovation of Charity Hospital and have it open in 3 years, so that the incoming residents this year who are going to be going to LSU and Tulane for medical school will be able to practice medicine in their final years of residency and take care of patients there.
I have another issue that I want to deal with, this idea of a hospital that deals with indigent patients. And I know we touched upon it a little bit, but I really want to deal with that. The plan that you guys have, is it a plan where it would still have mainly indigent patients and not third-party players?
The unknown there is just as if with the LSU plan. Just because you open up a hospital, you have no guarantee of who's going to come. Now, they're both going to be public hospitals, so we expect that the large majority of the patients going to either of these facilities would be indigent.
Okay.
Because LSU is charged in this state with taking care of all the uninsured patients in the state. That is their responsibility.
But
they get 100% of the dollars to do that. So we would expect that patients who are uninsured from the entire state of Louisiana will use Charity Hospital. Now, it'll be a nice enough facility with excellent care that we would hope that patients with private funding would use it as well to help offset some of the cost.
And again, it goes back to, it doesn't matter what building you're in, you're still going to have the patient mix. It doesn't matter what building you're in to have the patient mix. The state wants to attract private pay. If you have world-class doctors and you have world-class reputation, you'll attract the private pay. It doesn't matter what building.
I can't help but deal with that, because is it even feasible to even think that those 424 beds, no matter how many it is, that there'll ever be enough for the amount of uninsured, whereas that they would even have room for those with private?
And you know, that's an excellent point, Chris. We have so many uninsured now, with the expectation that that's going to probably rise unless President Obama does something regarding health care reform. But you're right, 424 beds is probably not enough for either facility. You know, Dr. Ollier at a hearing was saying they're already looking at having to need 650-bed facilities to take care of all the uninsured. So that's a whole nother obstacle in this state, because we're a poor state with so many uninsured patients, with a system that makes them all go to the charity hospital system, which is a good system.
But they're also looking at more clinics and more preemptive health care.
Absolutely.
Rather than wait until it's time to go into the hospital and have to take up hospital beds.
This doesn't have to be an either-or thing. We're not saying that we want to concentrate all indigent care and all health care at Charity Hospital. That's not what we're saying. We're saying it serves a purpose right now. We need more health care in this city, both primary care and specialty care for the uninsured. And that's what this hospital is all about. Restoring services for the uninsured, because the system's broke. You can see it. We have mergers of hospitals, closings of hospitals. The system's somewhat broke. But this is one piece that will at least get us back on the right track. We're all for primary care clinics in every neighborhood.
Right.
The medical home model is a wonderful thing, but it can't be an either-or thing. We can't replace Charity Hospital with 5 medical home districts in the city. That's not going to address our health care concerns or issues.
And just so the people can understand, the optimal issue is for people to have clinics in their neighborhoods.
Absolutely.
And then they'd be able to go to the major hospital if needed, if they're uninsured, where the emergency room will not have to be the primary care place, which it is now.
Right. And we're happy to take care of patients in the emergency room. As an emergency physician, you know, that's not the problem. But they need more long-term care that we can't offer in the emergency room. Okay. That's where medical homes and primary care clinics in the communities, and then a hospital such as Charity being online in 3 years will help us get back on track. Plus, for the community, we keep talking about economic development. You know, 10 years of building a hospital is not economic development. Reopening a hospital in 3 years and bringing in research dollars and other resources, that's economic development. But construction jobs is a very small part. We should be thinking much bigger than just bricks and mortar.
Go ahead. The bottom line is people need to be able to say, hey, I have a physician, I need to be able to go there and get the help that I need. That's awesome. Right. We're going to go right to this real quick. If you can, we can throw up that last slide showing the new beautiful hospital that they're trying to put together right on Tulane Avenue to take Art Deco building. That's what it is?
Yes.
I don't know a lot about...
We'd build a front atrium to it, have centers of excellence. It would create a... this is not the slide.
That's
but
all right.
It would create a new front to it. We can fit in 446 private inpatient rooms at this point. These are all no ward system. This is all private inpatient. And we think it's a beautiful building. We think it's something that people cherish. One of the things we're finding out with the new hospital is that they want them to build a centerpiece that will be an iconic vision of their medical center. And it's so funny because you've got one of the most iconic buildings existing right now. It's known across the world as Charity Hospital, and it's a beautiful Art Deco building. Cannot be replaced. The limestone shells, it's just something that you couldn't afford to build nowadays.
Hey, I'm starting to appreciate a little bit about architecture. I went down to the Art Deco Festival in South Beach, so
Oh, there you go.
We're doing good. Sounds good to me. A beautiful city. Hey, let's go right to the camera. Let's give a take-home message that you really want those viewers to know.
Well, I think we've been going back and forth between the state and the, quote, preservationists, and what we're down to the point where we're asking the state and the governor and our officials to call for an independent cost-benefit analysis. Let's compare the two studies, but more importantly, what it means to bring them online faster, what it means to the community. We're also asking the New Orleans City Council and the City Planning Commission to start discussions about this. This is the largest plan that's going in New Orleans history, and yet it's all being planned behind closed doors. And the last is that you've hired a Goody Clancy to do a $2 million master plan of the city, and they've been told they can't touch the medical center. So it's a matter of, let's open the doors, let's have transparent government, let's discuss this and really get people involved because it affects everyone in Louisiana. This will take the tax money from everybody in Louisiana because it is such a big project.
Wow. Go ahead. Doctor?
Yeah, having worked at Charity Hospital, I can tell you it's a system that works, and going back into the old building but making it a state-of-the-art building is clearly the way we should go. Access is an issue. Many of you are probably somewhat immune to what is going on in this city or in this state regarding health care, but with 40% of the people either uninsured or underinsured, I'm speaking to you, who right now when you get sick, short of the emergency room, you have no place to go. And when I discharge you from the emergency room, you still have no place to go. We can address that and fix that, and within 3 years, we don't have to have third world type conditions here. So I appeal to you to call your legislators and speak to those congressmen and say, look, let's make this more transparent. This is the biggest project we're going to have in this city over the next 10 years. There should be dialogue, the city council should adopt it, and let's hear more voices on this, because clearly we have a viable option right now that's going to work.
Awesome, Ms. Stokes, Dr. Moises, great information. We appreciate you so much. I'm your host, Chris Sylvain, with Health Issues 2010. Visit us on the web, healthissues2010.org. Believe me, we appreciate you being a part and participate. Healthcare is a right, and everybody should have it. Thank you so much.
I hate being on camera. I mean, articulate.